Inclusive coaching. We will be looking at specific considerations pertinent to particular types of impairment. Some disabled individuals may be able to participate effectively, without any adaptation to rules, equipment, or techniques. However, for other disabled participants, it may not be appropriate for them to participate in the full version of the sport or physical activity. Such individuals may be able to participate in an adapted version of the sport. Let us now look at some specific impairments, what specific consideration we need to understand, how as a coach we might adapt or deliver differently to them. Also, students' health issues need to be considered to ensure we are coaching inclusively to all members of our classes. It is highly recommended that you should also take the BAB Managing Risk, Equity and Communication courses in conjunction with this course. Participants with a learning disability. As a coach, you should ensure your players understand the specific safety rules associated with Aikido. Situations that appear to be an obvious danger may not be perceived as such by some individuals with a learning disability. It is important to support the individual to be as independent as possible in such situations. Participants with a learning disability are also more likely than their non-disabled peers to have convulsive disorders, such as epilepsy or asthma. If a participant has epilepsy or asthma, it is important to understand how it is dealt with on an individual level, as this can differ from one person to another. Some people may have relatively poor self-care skills and will need guidance in areas such as appropriate clothing. Is an outfit too hot or too cold? Is an outfit suitable for the Aikido? Avoidance of exhaustion and dehydration. They may need to be reminded frequently to drink. Some individuals may have low or high pain thresholds. Some participants may not react to certain situations as you think they will. Expect the unexpected. If additional assistance is required, ensure those assisting understand what is expected of them, from both the participant and you as a coach. Coaching learning disability members. The following points may help you communicate effectively with players with severe learning disability. Remember not to make assumptions about an individual's communication requirements. Always address the person by name, not to a helper if accompanied. Establish the extent to which instruction and directions are understood. Use simple, brief, concise language, without being patronizing. Refer to participants according to their chronological age. For example, you placed yourself well, rather than good boy. Some people with learning disabilities may use a signing system to support speech, such as Makaton or Bliss. Some participants may need more time to say something. Be patient. Ask participants to repeat what they have said if you have not understood them. You can also ask questions to which the answer is either yes or no to establish whether or not you have understood them. Dyspraxia. Dyspraxia, also known as developmental coordination disorder or DCD, is a surprisingly common condition affecting movement and coordination in children and adults. To help teach and coach Aikido, it is often necessary to move their arms and legs for them a number of times to help them understand the process. First, ask if it is okay to hold the student, stand behind them and assist them in the correct body movement. Do this a number of times until muscle memory takes over. Dyslexia is often linked with dyspraxia. It sometimes helps to provide a verbal description of a technique name, but also a written label. An often misconception is that people with dyslexia cannot read. Sometimes they need both communication methods to record the information. ADHD. Attention Deficit Hyperactivity Disorder. ADHD is one of the most common childhood neurodevelopmentally disorders, affecting around 8.8% of children and youths under the age of 17. It's often characterized by inattention, impulsivity, and hyperactivity. Though these symptoms often occur together, not all young people will exhibit all three. Some young people with ADHD that are hyperactive thrive with non-team sports that require individual focus, where the coach can dedicate more one-on-one attention and help them focus on one task. Examples include wrestling, swimming, and martial arts. As a coach, you tend to need an extra coach to assist, or arrange other more senior grades to train with them, ensuring the safety of the student and the rest of the class. Autism and Asperger's. Like a learning disability, autism is a lifelong condition. Autism is sometimes referred to as a spectrum, or autism spectrum disorder, ASD. Autism is not a learning disability, but around half of autistic people may also have a learning disability. Often a student can be highly intelligent and intellectually know as much or more about Aikido as you the coach, but they may have difficulty physically performing the art. On the other hand, some may be technically perfect. Not always, but often they have the tendency to say exactly what they are thinking, which may seem rude at times. Asperger's syndrome. People with Asperger's syndrome see, hear, and feel the world differently to other people. People with Asperger's syndrome will not usually have a learning disability. However, they may experience challenges such as specific learning difficulties, anxiety, or other conditions. Coaching autistic members. Autistic people can struggle with communication. Here are some things to think about when supporting an autistic person. Find the preferred communication method, then be clear, concise, and direct. Allow 6 seconds before saying anything else. This will give them the time to process and react in their own way. Many autistic people are visual learners. Ensure they can see you fully, place them in the middle of the teaching line. Teach from both sides. Some autistic people may interpret language literally, avoid phrases like pull your socks up. Autistic people may struggle to make or maintain eye contact. But this does not mean they are not paying full attention to you. Try not to rely too much on your body language and facial expressions. Some autistic people may not understand how to interpret them. Many autistic people have sensory sensitivity. This may be too loud noise like music from the class close to you or badminton be played loudly on the next court. Also, flashing light may affect their concentration. Cerebral palsy. Cerebral palsy is not a disease or illness. It is a brain lesion that is non-progressive and causes variable impairment of the coordination, tone, and strength of muscle action, impacting on posture and movement. No two people with cerebral palsy are alike because the brain damage that causes the condition can evolve differently in each individual. You may not be very familiar with this condition, so it may help to meet the individual first before considering the particular safety issues of which you need to be aware. Participants may be prone to accidents and injuries because they have problems with balance and coordination. Individuals with cerebral palsy may also more frequently experience dehydration, muscle cramps, and exhaustion. Coaches, therefore, need to take extra precautions in hot weather and during hard training sessions by giving opportunities for rest and to take on liquids. Individuals with cerebral palsy may have speech impairment. This should not automatically be associated with the individual having a learning disability. Individuals may have devised individual means of communication. Again, it is useful to spend time getting to know the player in order to learn and understand these means of communication.
Amputee participants. Amputees have greater difficulty in regulating body temperature because the ratio of surface area to body volume is different and could result in overheating. Coaches should therefore ensure players wear suitable clothing and ample opportunities are provided for rehydration. It is important to take good care of the stump. The stump should be checked regularly, any breaks of skin treated to avoid infection and allow healing. Some amputee players use an artificial limb known as a prosthesis. An everyday artificial limb, as the name suggests, is not designed to withstand the pressures of training and competition. So, members should be advised to see an artificial limb technician to have a sport-modified prosthesis. Modern technology and materials ensures that an artificial limb can be immensely strong and extremely light. But if it fails, it could cause an injury. So, coaches need to ensure the participant checks that the prosthesis is suitable for Aikido. Regularly checks for signs of wear. Is aware that it may take some time to get used to a new artificial limb. Respond to complaints of soreness in the lower back by checking length and weight with the artificial limb technician. Ensure the stump sock is changed regularly.
Visual impairment. When coaching visually impaired aikidoka, it is useful to remember the following basic points with regard to safety. Do not leave equipment lying on the floor, and always leave it in the same place each session so people know where it is. Allow participants time to orientate themselves in a venue, and pinpoint any potential dangers such as slippery areas, doorways, and obstacles. Be aware of any changes in the environment that could cause an injury, such as open doors, cupboards, windows, discarded kit, or even someone walking into an open space unannounced. Members with a detached retina could be at risk of further detachment if they experience a blow to the head. Participants with glaucoma should gain medical advice prior to training. Visual impairment coaching. Remember not to make assumptions about an individual's communication requirements. Some are totally impaired, some only partially. If they wear glasses, provide a safe space if they take them off for training. Otherwise, check they are sport safe by having plastic lens. Always address the member by name and state your name. Do not walk away from the member without telling them. You may need to use touch, but ask first. Stand behind them and move their arms and feet to help them understand the movement. Use keywords with what you are trying to say and avoid long, complicated statements. Be logical and sequential. Ensure verbal instructions are concise and accurate. Be aware of the influences of environment factors that can influence how you communicate information. For example, amount of available light, changes in light, type of light, both fluorescent lights and floodlights, position of individuals and/or the coach in relation to the source, level of background noise such as echo or reverberation, ventilation fans, music or other sports happening in the same hall. Hearing impairment. Coaches must give sufficient time to ensure that participants with hearing impairment fully understand safety regulations and procedures. Use hand signals for commands, like Rei, Hajime, Mat-te, and Yammei. Consider learning some BSL signs. https://www.signbsl.com can help you. Some people will wear hearing aids and you will need to determine when it is safer to wear them or leave them off. Hearing impairment communication. Remember, not to make assumptions about an individual's communication requirements. The student will need to see your mouth move, so there is an opportunity to lip read. Ensure your face is lit from the front, so that your mouth can easily be seen. This will aid lip reading. Face the participant at all times when speaking to them. If you turn your head, they will not be able to read your lips. Do not shout or cover your mouth with your hand when talking. Reduce background noise that may interfere with your coaching. You may need to be near the person to attract attention. Example, by tapping on the shoulder. Keep sentences simple and avoid unnecessary jargon. This is particularly important for individuals who have been born with hearing loss. Consider developing your own simple system of signs and gestures. Use an interpreter. Sometimes a family member will come along and sign for them. If relevant, provide written information, but do not give them the written information to read and then continue to speak, as the person will be unable to lip read or even be aware that you are speaking. If your association or club has a website with written information and video, it would be a good idea to ensure they have the URL, as it will help them to understand at their own pace. Wheelchair users. It is unusual at Aikido to have a wheelchair user, however, it does happen. Aikido training by people with lower limb impairments such as paraplegia has been known to take place. Paralysis may affect the body's ability to perspire below the site of the lesion, so overheating can occur. Some people may have relatively poor circulation, so need to change their sitting position to encourage blood flow. Therefore, wheelchair users are prone to pressure sores because of poor circulation and movement restrictions. Poor circulation may also cause dizziness. Participants with tetraplegia may have decreased breathing efficiency because the diaphragm muscle may be the only respiratory muscle that remains in working order. As a coach, you should be aware that some wheelchair users use special appliances or procedures to compensate for loss of bowel or bladder control. Usually, the only requirement for individuals is privacy and adequate facilities for carrying out necessary personal procedures. Occasionally, accidents occur because individuals are unable to feel sensations in their limbs. For example, hand blistering as a result of pushing, and cuts and scrapes from the wheel can usually be avoided through adequate taping of the fingers and use of padded gloves. Coaching wheelchair users. Do. Have an inclusive attitude. Address the individual, not the person who may accompany them. Talk to the person face to face, and at eye level. Rotate yukis unless the person has a particular partner. Ensure the wheelchair is suitable for use on the mat. Adapt a technique to allow yuki to land safely, or the tori to take a suitable lock. Ask if they want to try a technique out of the chair. Don't. Move a participant when seated in their wheelchair, ask them to move. Lean on a wheelchair or hang things from it. Assume an individual needs a push or additional help. For example, when carrying a kit bag, always ask.
Cardiac issues. It is not unusual for people who have had heart problems to be recommended by their doctor to start exercise. Some start Aikido, others may already be members. As a coach, you need to know how to deal with them. Firstly, you are not a doctor, unless you are. They need advice from a doctor to start or return to training. Also, consider purchasing an AED, more details on that later. Pacemakers. Risk of a blow to the chest or physical contact should be avoided. Consider suggesting a chest protector, known as a pacemaker shield. Stents. People can expect to return to a pre-disease exercise state within 1 month of having a stent fitted. Heavy exercise should be avoided for about 4 to 6 weeks, but doctors recommend regular exercise after that. More cardiac issues. Strokes. After a stroke, 60 minutes exercise a day is recommended by doctors. Loss of full control of a limb or sight may need adaptation by the coach. Members must start training slowly and build up to full training as directed by a qualified person. Post-heart attack. Follow a rehabilitation process provided by a doctor, only then start light Aikido before working up to full training. A doctor should advise when and if this is possible. Blood thinners. If a member advises they are taking blood thinners, they should confirm with a doctor they are able to train, have a procedure at the club to deal with any heavy bleeding by updating the club first aid kit. Consider the possibility of internal bleeding may occur more easily.
Should I buy an AED? The answer is yes if you have the spare cash. If not, it is possible to get match funding. Ask your local council or local active sport organization. Also, if you search funding for a defibrillator on the web, you will see many options for funding. If you can't afford this option, then search the web for defibrillator near me and know where your closest one is. Other options: https://nddb.uk or https://defibfinder.uk. Note these gave very different results to a postcode added by the author.
Blood clots. If a member advises they suffer from blood clots, they should confirm with a doctor they are able to train. As a coach, it's important to remain vigilant about the signs and symptoms of blood clots. These include deep vein thrombosis, DVT. Swelling, usually in the leg, also in arms, especially in weightlifters, gymnasts, etc. Leg or arm pain, or tenderness, usually described as a cramp. Reddish or bluish skin discoloration. Leg warm to touch. Pulmonary embolism, PE. Sudden shortness of breath. Chest pain, sharp, stabbing, may get worse with deep breath. Rapid heart rate. Fainting or passing out. Unexplained cough, sometimes with bloody mucus. High blood pressure. Being active lowers blood pressure by keeping the heart and blood vessels in good shape, lowering the risk of heart disease and stroke. If a member has high blood pressure, a doctor will probably suggest that they become more active to lower it. It is best to ask newcomers to a class if they have high blood pressure and if they are on medication for it. This sort of information should be on your club application form, but sometimes it is better to discuss such things privately in case they omitted it from their application form. There is a link between high blood pressure and stroke. High blood pressure can lead to stroke in different ways. It can lead to blood clots in the brain, and can damage the tiny blood vessels deep inside the brain. It can also make a stroke due to bleeding in the brain more likely. As a coach, if you notice red face flush, nosebleeds, very heavy breathing and chest pains, then ask the student to see a doctor. Hidden disabilities. It is not always possible to see a disability, so it is up to the student to advise their medical issues to the coach. Also, the student must decide if they want their medical information disclosed to the class. You have a duty of care to everyone. Sometimes as a coach, it is correct to advise at least one other trusted senior grade in case you are absent. Epilepsy or seizures. People with epilepsy have no greater chance for injury during Aikido than people without epilepsy. The chances of a serious injury are small compared with the positive effects of participation. Consider the type and frequency of seizures. What would happen if they had a seizure while at Aikido? Have a plan ready, and ensure enough members of the class are aware of the plan. Does flashing lights affect the member? Request them to ask a doctor about the risks and for individual advice. Hidden disability diabetics. Kidney diseases or diabetics. Although moderately intensive exercise is safe, high-intensity exercise may increase the chance of muscle and kidney damage. But many people participate in Aikido with kidney damage, or only one kidney. Some are diet-controlled, some use insulin injections, others have an insulin pump. Before training, ask your member if they have eaten or injected and they are feeling fine. Know if they carry insulin or food like a Mars bar, they may need quickly. Have a procedure in place in case of them suddenly collapsing. Consider suggesting a kidney shield that provides an extra layer of protection. These are recommended when taking part in any activities in which they could fall or get a blow to the abdomen. Hidden disability asthma. Exercise is important for overall health as well as lung health, and there are many benefits of physical activity for people living with asthma. Daily exercise like Aikido helps to improve the lung capacity. If a student suffers from asthma, know where their pump is, ask them to keep it the same place each training session. They may have more than one type with them. There are 3 main types of medications used to treat asthma. Relievers, blue. As a coach, the blue inhaler is important. If your student asks for it, or they start coughing or wheezing, help them access it quickly. If they recover quickly, they may resume the class. Some students may use the inhaler before class. Preventers, brown, purple, red, orange or yellow. Some people may use this before training, but it is not suggested that you use it during an asthma attack. Symptom controllers, green. These will not help a sudden attack.